is Liz Cook, and she's approved Ziggy for this task. Before I put my hands on Ziggy, I'm going to make sure she's not aggressive or fearful, and she's not going to attack when I open the cage. And she's not. I can hear her purring, and she's rubbing against the fence or the side of the crate, so she's ready to get out. And I'm not afraid of her, so I feel comfortable going through this physical exam. Come on, Ziggy. Ziggy is a domestic short hair, a calico tabby. She's been spayed. We spayed her here at this clinic. Just looking at her, I can see that she's got something going on with her right eye. So I'll definitely make a note of that. But I'm going to look farther. I'm going to go through all my systems in my physical. We'll start with ophthalmic with her eyes. So I know that she's had this issue for a little bit, and I know that my doctor has seen it before. But I'll still make a note so he can check it again and see if it's progressed in any way. As far as everything else with her eyes, I don't see any intropin or ectropin with her eyelids. I don't see any obvious conjunctivitis. But I will look a little deeper with my instrument here. I'm going to check her pupil's response to light. And even with that scarring or that injury to the right eye, her dilation and constriction is normal when the light is added. So I'll move on to the audit system. I'm going to check her ears. When I check her ears, I'm checking for redness or debris, and I don't see anything like that. But I'll still try to use my tool if she cooperates. I'll still try to use my tool so I can see a little deeper in that ear. What I'll do is I'll extend that pin up, and I'll put it down her ear just a little bit so I can try to check her tympanic membrane. I'm still looking for redness, swelling, and extra debris. I don't see any in the right ear. I'm going to check this left one. You're such a good kitty. And everything looks normal there. Cleaner than most cat ears. I'm going to move on to the integumentary system. I'm going to check her skin. I'm going to start back here. And I'm looking for redness, scabs, flaky skin, any evidence of external parasites, flea dirt, ticks, anything like that. And I don't see anything like that. I'm going to check around her rectum area. I know, I'm sorry. I'm just looking for the same things. Redness, swelling, irritation, hair loss, anything like that that I could note for the doctor. And I think she seems fine there. I'm going to move on to my nervous system. You can check it several ways. Most often you see this. You just flip their paws, and usually they correct them right away. If they didn't and they left their paw upside down, that would let us know there might be an issue that we could look deeper into. And I've seen her walk some, so I know that she's not dragging anything. There's no head tilt. I'm going to go on to the circulatory system. I'm going to auscultate her heart. I'm going to be listening for arrhythmia. I'm going to feel her pulse for pulse deficit. I didn't hear any abnormalities there. No pulse deficit. There was a pulse for every heartbeat. That heart rate's gonna be right around 144. Now I'm gonna auscultate her lungs, her respiratory system. Okay, I was listening for crackling or any abnormal sounds in her lungs, and I didn't hear anything like that. Everything sounded normal. Okay, so now I need to check my musculoskeletal system. So how I'll do this is I'll just watch her walk, which I've seen her walk previously, and I didn't note any limping or dragging of the limbs, or tenderness or pain in any of the limbs. And so I feel comfortable saying that everything's normal there. Now I'll move on to my digestive tract. What I'm going to do is I'm going to just do a physical palpation of her abdomen area. So I leave my hands flat like this, and I'm going to put them on each side of her abdomen. I'm going to press inward with gentle pressure and just let internal organs just kind of roll through my fingers. I'm feeling for anything enlarged, any abnormal masses, anything abnormal that I could note for the doctor to look deeper into. I don't feel anything like that. Everything is just kind of rolling right where it should be. Everything feels normal there. I also need to check her urinary system, which I'll just look right around her exit area, her vulva area, and I'm looking for discharge or redness or swelling or hair loss where she's been licking it. There would be anything to let me know that she's having a problem there, and it doesn't seem to be having a problem. Everything looks normal there. What I'd love to do is I need to check her lymph nodes. So I'm checking for enlarged lymph nodes. They seem to be normal size. They're normal size there.
Okay, so first we kind of look at them and just overall how they're acting. He's bright and alert, he's looking around, he's nervous, so his fur is flying everywhere. But overall he's bright and active. So what we do next is we kind of feel and make sure that they're not too chunky, not too skinny. Rabbits should have pretty good fat stores around their spine, but you should still be able to feel it. And then what we do is feel in their abdomen and make sure that there's nothing strange going on in there. No impacted food, no tumors. I can feel his kidneys, they're a good size. He doesn't care for this so much, but it's a good way to feel what's going on inside there. Okay. Then what we do is listen for gut sounds. Rabbits have really, really important and sensitive GI systems, so you should always be able to hear the gut sounds. Okay, and they're nice and frequent, so that tells me that his gut is healthy right now. Then what we'll do is listen to his heart and lungs, make sure we don't hear any murmurs or arrhythmias. Easy, bud. Okay, and everything sounds good in there. Then what we'll do is turn him upside down so that we can take a look at his underside. And so what we'll do now is look at his nails, check out his joints, make sure that everything down here looks good. No foot sores or anything like that. Looking so good. Make sure there's no issues down here. And just kind of overall looking at coat quality. Move up to the front limbs. He just had a pedicure, so his nails are not super long. No, you're okay. Okay. And then we'll go ahead and place him back down. Easy, bud. Okay. Give me a minute. Okay. And then the last thing that I examine is their heads. So rabbits have a tendency to be really nervous when things come up to them because they're a prey animal. And so I always leave that until last. So we'll check the eyes, make sure that those look clear. That there's no issues with those. Boy. And then we'll check his ears as well. Make sure there isn't excess gunk in there. Very well. And then the last thing that we do is look in their mouth. Rabbits have a tendency to have dental disease, particularly if they're not on an appropriate diet, meaning majority hay. And so sometimes their teeth can become overgrown and then we have to actually trim them down. So I always leave this until last because they tend to not like it very much. It's okay, buddy. So the last thing, then you're all done. So we'll check his nose real quick, make sure there's no drainage. And then check out his teeth. Rabbits have their incisors in the front that they use to grab food with, and then they also have some cheek teeth in the back. And sometimes if they're not on an appropriate diet, that those cheek teeth will overgrow and form points, and sometimes it can make them stop eating because it's just so uncomfortable back there. So we'll take a look back here. Get your tongue out of the way. Boy. And no points on that side. I can see his mucous membrane color. It's nice and pink and moist. I can actually see food back there. He was eating his breakfast this morning. Let's check the other side. Good boy, George. And this side looks good too. All right, that's the end of your exam. You're okay, bud. So that is how we do exams on rabbits at Warren Woods Veterinary Hospital. And we recommend having an exam every 6 to 12 months or so that way we can kind of catch things and make sure that there's no issues and catch them ahead of time so that way we can do something.
The first part of my exam, I'm going to start with the head, and I'm going to check for facial symmetry. So I'm going to look, and I'm also going to feel. I'm going to run my hands along the muzzle, along the mandible, along the maxilla, up around the orbit. I'm going to press over the eyes gently. I'm going to feel on top of the head, So I'm feeling for any asymmetry that might suggest that there's a swelling, a mass, and I'm also noting if there's any discomfort when I do that. Next, I'll look at the eyes, and I'll note if there's any epiphora or staining discharge from the eyes. I'll also notice if there's any blepharospasm or squinting from the eyes. I'll bring the lid back. I'll look at the sclera. I'm going to note any discoloration. I'm also looking at the conjunctiva, the cornea, the iris. I'm also going to check for a pupillary light reflex. I want to see pupil constriction with application of a light. The light also helps look inside at the conjunctiva and the sclera. Next, I'll move my way down to the nose. I'm going to look at the nares. I'll note any discharge. If I have any concern about airflow, then I'll take a Q-tip and see if there's any movement of the cotton as I place it next to the nair, or I can use a microscope slide to see if it fogs when placing up next to the nares. Next comes the mouth, and the first part is I'm going to put my fingers, I'm going to lift up, I'm going to look at the gingiva, the cheeks. I'm looking for any discoloration. I'm looking and I'm checking a capillary refill time by pressing on the gingiva and noting how long it takes to go from blanched to normal. I'm looking at the teeth, noting any calculi, tartar, looking at the gums, noting any gingivitis. Checking for cracked teeth, missing teeth. So she has a missing upper right canine. She also has some missing incisors. And you usually only get 1 or 2 peeks inside the mouth when you open their mouth. So make sure you have good lighting. Point their nose sort of towards the ceiling. And I think it's easiest to grip right behind the canines, open up the mouth, take a look way back there, lift up the tongue. So it's a short glimpse, but I feel like I was able to see everything, including the tonsils, the palate, the tongue underneath the tongue. Once I'm done with that, I'm going to look at the pinna of each ear. I'm going to note any discoloration, any discharge at the external ear canal opening. I'm also going to palpate the external ear canals gently. They should be firm, but they should be somewhat compressible on the outside, and they should not be painful. If they're firm, mineralized, painful, that could be an indication of inflammation, infection. Next, I'm going to do my otoscopic examination. So every dog's a little bit different in how they tolerate this examination. And some dogs won't tolerate it much, and you may need to sedate them. So what I'll do is I'll hold the pinna up. I'll bring the cone in, bring it down through the vertical ear canal. Then I'll lever it to look down that horizontal ear canal and into see the tympanum. Yeah. Let's move over here. Yeah. Good girl. Yeah, you're just going to lie down, aren't you? That's okay. We can do that. Yes. Okay. Okay, we're done with that. I didn't get a great view inside of that right ear. So if I'm concerned about anything, it may require a little bit of sedation to take a deeper look. Now I'm going to continue my examination by palpating the mandibular lymph nodes. So they're at the corner of each side of the mandible. I'm going to work my way down and feel the larynx, Feel the area of the thyroid glands, which usually are not palpable. Feel the trachea. And I'll come down to where the neck meets the thorax. I'll feel the prescapular lymph nodes. And the prescapular lymph nodes are just cranial to the distal part of the scapula. They're not always palpable. And then I'll run my hands down the front limbs, and I'll do this simultaneously because that allows me to appreciate any asymmetry. If there's muscle atrophy, if there's any lumps or bumps. If there was any concern while watching Barley walk around, and I was concerned about limp or a neurological problem, I'll do a full orthopedic examination. I'll pick up the feet, look at the pads, look at the nails, digits. Then I'll work my way back, running my hands over the thorax. And again, I'm feeling for any kind of masses, areas of discomfort. And now I'm going to do my thoracic auscultation. I'm going to use the diaphragm part of my stethoscope. And I'm going to feel for the point of maximum intensity of a palpable heartbeat. So I use my left hand here. I feel for that. And that's where I'm going to put my stethoscope, because I know that that is going to be the apex of the heart, so I can hear the mitral valve the best there. If I move a little bit dorsal and a little bit cranial, I should be centered over the aortic valve. And then a little cranial yet is the pulmonic valve. As I listen to the heart, I'm also palpating with my right hand the femoral pulse. I'm noting any pulse deficits and also the strength of each pulse. If I'm having a hard time hearing heart sounds, it might be necessary just have the patient stop panting. So you can bring your hand up like this and just sort of point their nose up in the air a little bit. Some people think it's a little easier to do auscultation, standing over the patient. I'm now going to auscultate the right side, listening for the tricuspid valve. Now I'll do my pulmonary auscultation. I'll slide my stethoscope more dorsal and move around the area of the chest, listening to lung sounds. Now it's easiest to do this while they're standing, and so you may have to work at this to get a compliant patient. Marley, can you stand there? And so you can support with one hand underneath to try to get them to stay standing. Okay. Now I'm going to continue my examination by bringing my hands down to the abdomen, feeling for any subcutaneous masses. I'm going to pay particular attention to the mammary glands, seeing if I feel any. Mammary glands run from mid-thorax all the way down to the inguinal region, so you want to do a thorough exam of the mammary glands. Next, I'm going to palpate the abdomen. And I think the easiest way to do this is to stand behind the patient. While they're standing, I'm going to use my fingertips of each hand and I'm going to press them together. And I'm going to move my fingers and let the organs sort of fall in between my fingers. So you can kind of appreciate them as they slip between your fingers. So in the cranial abdomen, you may be able to palpate the caudal edge of the liver. And in the ventral cranial abdomen, you may palpate the spleen. It's sort of a firm organ. Dorsally, you might be able to palpate the kidneys. Mid-abdomen, you can palpate the intestines, not necessarily individually, but you can feel loops of bowel slip between your fingers. And then caudally, if the bladder is full, you can palpate the urinary bladder. You also want to note if there's any discomfort during this examination. Now I'm going to run my hands down the hind limbs of the patient, again simultaneously left and right, noting any muscle atrophy.